Welcome to KDMS Hospital, a hospital dedicated to caring for bone, joint, and muscle. At KDMS, we provide care across 6 specialized fields. The first field focuses on knee and hip disorder. We also specialize in spinal care, sport medicine and shoulder care, hand, wrist and arms, feet and ankle, including rehabilitation, medicine and physical therapy. All our pathways are step-free, whether it's for bathroom, exam rooms, or recovery area. Here, we focus on planning treatment together with the patient to ensure the most effective treatment and recovery. Not every case requires surgery. In the market, we have many brands of the robotic technology. But the technology that use the CT scan to make the 3D bone of the patient is a very accuracy because we use the numerous of the picture from the real bone to reconstruct to the 3D. So in the world, there are many types of the robotic machine to use in the hip and knee replacement surgery. But the robotic machine that use the CT scan of the bone of the patient to planning of the operation and use during the operation is the most accuracy because the CT scan are numerous picture from more than X-ray. So in Thailand, we have 5 hospitals that use this type of robotic assist surgery that use the CT scan. KDMS is one of the 5 hospitals in Thailand that use this technology. Before surgery, we send patient to CT scan of bone and joint and use the picture to build the 3D imaging of the joint and use to plan the procedure. The benefit for the patient is precision and reduce the error. The machine can prevent the error that not more than 1 millimeter or 1 angle. That is very precision. The more accuracy that make it a good result and create the faster recovery for the patient. The OA or osteoarthritis is the disease of the cartilage that is damaged by time by the patient used for a long time. So the risk is the aging, the body weight. So the sign symptom is the caused from the inflammation at the joint. So the inflammation cause of the pain, joint pain. For the knee, is around the knee, on the front or the back of the knee. For the hip, is at the groin, anterior of the hip. So the second thing is from inflammation is about the swelling from the soft tissue in the joint or from the fluid that abdominal produce. The second problem is from the malalignment or the change of the alignment of the lower extremity that you will see the patient may be bow leg that is from the disease progression, more severity, cartilage are damaged so much. So the leg of the patient are changed in the abnormal alignment. So cause of the abnormal when the patient is walking or just standing is cause of the pain and unstable. For the hip and knee replacement surgery, we are not do the same operation, same technique for each of the patient because of it's different from the bone sizing of the patient, such as the female that is a very small bone. So it's a prosthesis is a small size too, and the prosthesis are many size that is increased step by step. So for the male that heavy or big guys, so you see this is a large prosthesis. So that the surgeon need to consider, measure, and determine that how is the proper of the sizing of the prosthesis to put in the patient. The second thing is the disease of the patient are not the same. So we need to decide that how to correct the angle, correct the position of the prosthesis, to correct about the problem of the patient, so to get the best result for the patient. So that means that for the patient, one by one, the majority of the step of the approach or surgery are the same, but the technique, the small technique, the balancing, the measurement may be not the same. The good surgeon need to do everything to put the best outcome for the patient. For the future direction of the surgery for the hip and knee replacement, I think is we use the computer technology to assist the surgeon to operate the patient more correctly, more precision. For 10 years ago, we used the navigation system that we put the signal on the bone of the patient. So when we operate the patient, we can see that the real-time movement, the alignment, the angle of the motion of the knee or hip during we operate the patient. Nowadays, it's going to be the era of the robotic. Robotic means that we combine the arm of the robot with the navigation system. So we are not only know that this is the correct angle, correct position, but we can cut the bone, we can prepare the bone on the way that we planning before surgery or during the surgery. I recommend for this cutting of the bone, that when we prepare the bone surface for the prosthesis, this is for the knee prosthesis. In the old time, that we need to cut the angle, any angle, and the thickness of the bone by the instrument that we measure by the conventional technique. But now, when we use the CT scan, we know the real anatomy, 3D scan of the patient, and we can prepare planning and prepare the bones more correctly and more precision. Nowadays, we can operate the patient that not more earlier than 1 millimeter or 1 angle. That is very precision, that more than the eye of the human can do. So I think the more and more we use the more technology to not instead the surgeon, but is to help the surgeon to do the operation more correctly, safely, and more precision for the best outcome to the patient. Okay, in here at the KDMS, because we have the technology that is the international, and I think it's a global technology. That is the leading technology for the hip and knee replacement. So in here, the 100% of the total hip replacement, we use the robotic assist surgery. So that is make more accuracy, especially about the limb lengthening, equal leg length, and the position of the prosthesis to prevent the complication such as the dislocation of the hip. But for the knee, in here we operate with the robotic assist technology around 70% of the cases. Because actually, if the disease or the condition of the patient are not so much difficult, so much damage, it's a simple osteoarthritis. So the conventional technique is a very advantage, and we can do the standard or conventional surgery for a long time. So if it's not so much complex case, we can advise the patient that they can select they need to select the robotic assist surgery to combine for the case or not. But for the complex case like such as severe deformity, severe bow leg or very stiff joint, it's we can get very advantage from the robotic technology. So we advise the patient that about the benefits, the cost and benefit, and everything that you will get from the robotic assist technology. I operate the robotic assist surgery here for around 3 years. It's more than 200 cases of the knee and hip replacement. So for the hip, the major concern of the patient is about the leg length discrepancy. That means leg length unequal after the surgery. That is the really thing that the patient concerns so much. With the robotic assist technology, the surgeon can see even 1 millimeter of the difference. So we can correct the leg length, correct the position of the prosthesis, everything. We can adjust and change that for the best result. That for the hip and for the knee. We are observed for 3 years that we noticed that the patient after operate robotic assist technology, the surgeon can make a smaller wound because we don't need to export everything to see all of the bone with the old fashion. With the robotic assist, you can do it with the computer. So the smaller size of wound, less pain. In here, around 40% of the patient do not need the morphine or the pain control from the morphine or narcotic after the surgery. That is very surprised me because when we do the conventional technique, maybe 100%, 90 to 100% that need the morphine after the surgery. In here, the oral medication can control the pain after the surgery. I think it's the benefit from the smaller incision and more precision when we operate. And if you are less pain, that is make you more recovery. You can walk more quickly, more longer before go out of the hospital. So the patient can return to the work or sport activity shorter than the conventional technique. When I observe here, it's around 2 months is the time to recovery that you can go back to working or go outside of the house, driving, or just playing the low impact sport. With the conventional technique, maybe 3 months that you are still pain or something else. So need to more recovery time. That is a thing that I see the good thing from the technology that bring to us in here. If you are experiencing joint pain or any related symptoms, we encourage you to consult with us for proper care. Feel free to contact us for a consultation.